Okay, so I'm sitting with Dr. Barbara Ries, and I wanted to catch up some time with Dr. Ries because in the last 4 to 6 months, Dr. Ries has seen a significant increase in her Invisalign cases, and I wanted to just get a little perspective from her. First, Dr. Ries, I'm just curious, what was kind of that spark? What made you think, now's a good time to really look at Invisalign for more treatment types and really pick up some of your volume?
I think what sparked it for me was when the new G3 things came available to us as practitioners, and I thought that there were some weak areas that I thought Invisalign had, and I thought that they were making amends and improving the product a lot, and that made me want to try more cases.
So I know that some of the features that we have are optimized attachments and some of the additional power ridges, but I know one that you've really embraced is the precision cuts. I think
Correct.
you have done a number of patients with the precision cuts. Tell me a little bit about that.
We find the precision cuts to be a really useful tool, and Invisalign has made it really easy to be able to use elastics for the patients by pre-cutting the aligners, because that was always a hassle for us to do that. And so it's been really nice to have those precision cuts right on the aligners and then placing the opposing attachments ourselves.
Do you feel like it's now opened up additional audiences for you to use Invisalign? In particular, I've seen an increase in some of your teenage patient starts and discussions.
Correct. So that when I feel like I need some molar correction or bite correction, that I am more comfortable doing that now with Invisalign, because we have an easy method to be able to use elastics.
Okay, and what do you think the reaction's been now you've been able to engage more people and feel more confident in recommending Invisalign versus just kind of offering it as an option?
I think people usually embrace the idea of Invisalign and are excited about it when I give them that option, and they're just so thankful. Because for a lot of them, they're not willing to consider traditional bonded appliances, and so this gives them an option.
What do you think, moving forward? Where do you think this Invisalign momentum you have? Where do you think this is going to help take your practice as we look at 2011?
I think it will continue to grow our practice with it, because we're offering options to patients now that I didn't feel comfortable 2-3 years ago.
Great. Well, I'm glad you made your premier provider. I look forward to seeing you move up to the elite provider in this year.
Thanks, Eric.
Okay, thank you.